Hi, welcome to the Doctor's Debrief podcast, presented by NDMD Productions and hosted by me, Vivien McCool, first-year medical student. Here on Doctor's Debrief, we're going to take a dive into some of the most impactful patient cases of a physician's career, the ones that are forever imprinted in their memories and have played a crucial role in shaping their identity as a physician. Although all of us have experience with facing and overcoming adversity, we seldom talk about the skills we use or the lessons we learn along the way. That's why, here on Doctor's Debrief, I'm passionate about being transparent about these hardships and the methods we use to overcome them to encourage others to follow their dreams and learn from every step of their journey, regardless of their circumstances. I'm your host, Vivien McCool, first-year medical student. You can find my YouTube channel in the link in the description below. And with that, please help me welcome today's guest. Today's guest is a neurological surgeon in Gainesville, Georgia. She received her pre-medical education at the University of Georgia before attending medical school at the Medical College of Georgia. After medical school, she completed her internship and residency in neurological surgery at Duke University before completing the SINS Spine Fellowship at Duke as well. She is affiliated with the American College of Surgeons, the Association of Women Surgeons, the American Association of Neurological Surgeons, and the Congress of Neurological Surgeons. Her surgical interests include minimally invasive spine surgery, disc replacement surgery, deformity and scoliosis surgery, as well as acute surgical management of traumatic brain injury and spinal cord injury. You might also recognize her from her YouTube channel, TikTok, Instagram, Facebook, truly wherever you might be, you'll be able to find her there. And she's stirring up a storm. Her YouTube channel is just over a year old and already has over 20 million views, probably more by now. Her TikTok has over 829,000 followers and 40 million likes. Her Instagram has over 124,000 followers. On her socials, she shares about her experience as a woman neurosurgeon, information about different medical devices and procedures, and most notably, goofy clips of her and her staff. So welcome, truly the one and the only, Dr. Betsy Grunch, the LadySpineDoc. Dr. Grunch, thank you so much for agreeing to join me today. I'm so excited for our interview.
Thanks for having me here. I'm excited to be here.
So funny enough, I met Dr. Grunch when I was a pre-med shadowing another neurosurgeon in her clinic. And I really wanted the opportunity to shadow Dr. Grunch because she is a woman neurosurgeon and just felt like that was a good idea at the time. And when I asked him if I could connect us, he obviously thought it was a great idea and went on about how Dr. Grunch is truly a unicorn in the field because women neurosurgeons are very rare. And I had such a good time shadowing her because, as you can tell from her socials, she's so funny, easygoing, just super chill. And she inspired me to remain true to myself while embarking on this rigorous journey. She inspired me to remain true to myself while embarking on this rigorous journey through pre-medical education. And so, Dr. Grunch, before we get into the thick of it, is there anything that I missed that might be of interest to the bright students watching or listening right now?
I think you covered it all.
Okay, good. So Dr. Grunch, you really are like a superhero in this field, and you've told me your origin story before into neurosurgery, and it was really so inspiring. So would you mind sharing that with us here? What brought you to medicine in the first place?
Yeah, so what brought me to medicine was basically I was 13 years old. Like most daughters, they really want to emulate their mom. My mom was a cop, so she was kind of a trailblazer in her field. This was in the early 90s, so there really wasn't many female cops out there. So I just really thought that she was kind of a badass, and I wanted to be like her. So I wanted to be a cop. And then in the summer, right before I started high school, about 2 weeks before we started high school, we had just gotten back from a family vacation, and she worked a very difficult area in our community at the time because she speaks Spanish, so she was in a very kind of rough part of town where there's a lot of gang activity. And she unfortunately was involved in an accident in which she was shot in the line of duty and in the car and struck a tree and was instantly a quadriplegic. So I remember talking to her neurosurgeon at the time when he came in and told us that she would never walk again. Was just devastating because I always, obviously saw her as just such a very active, on the go kind of person. So we spent like the next 6 months going through rehab. We live in the Atlanta area, so we were at the Shepherd Center, which is one of the best spinal cord injury rehab centers in the entire world, really. So I got to experience in depth like many stories like hers, many young people with spinal cord injuries. And was just really kind of angry that something could be dealt to someone, and then that would just be it, and that's their life. And so I really became motivated to want to learn more about spinal cord injury and want to learn how like maybe we can fix spinal cord injury or cure spinal cord injury. So I began to shadow her neurosurgeon, which was the one that did her surgery and delivered that news to us. So all throughout high school, I kind of worked alongside him, just shadowing him as well as working in his office in the summer. And I just decided that I wanted to become a neurosurgeon. So fast forward to now, and that's where I am. So yeah, that's the short version of my story.
That's amazing. I love how it was like you always knew. It wasn't like you just wanted to, not just wanted to be a doctor, but it wasn't like you were like, I want to be a doctor and like maybe this field or maybe that. And you just had this life experience that really like jarred you to this path. Like it was like meant for you.
Yeah, it's funny because obviously being a young woman, wanting to like be set on becoming a spine surgeon and a neurosurgeon, like it was kind of almost like, I got that look like, that's cute. But I told everybody I'm going to medical school because I am going to become a neurosurgeon. And I didn't want to become anything else. I mean, of course, I kept my mind open throughout medical school and looked at all the fields, but I just always knew that was my passion and what I wanted to do. So,
well, safe to say, just like your mom, you are a badass as well.
thank you.
So I guess that kind of answers my next question, which was going to be, are you happy with this specialty?
Oh, absolutely. I wouldn't want to do anything else.
Was there anything else that like in med school you were like, that's like not the worst, like possibly maybe?
I mean, I really like surgery of all kinds. I just am the kind of person that really likes working with my hands, like taking a problem and physically solving it. And so all surgical specialties were very interesting to me, and I still love all kinds of surgery, especially I really like trauma surgery, probably for the same reasons, but just really like taking somebody that's kind of really in a emergent situation in that adrenaline rush and just going and taking care of it. But I did consider that too along the way, but I just really enjoy neurological issues and taking care of those kind of patients. So
I think you're made for it. So, Dr. Grunch, people visit you in some of the most painful, dire, and vulnerable moments of their lives, searching for hope, answers, and healing. What would you say are some of the most impactful patient experiences that you have had thus far, whether that be in difficulty of diagnosis, the emotional context of it, or the patient's ultimate outcome?
I mean, there are stories that I encounter like every single day, really, that just are really moving and inspiring to me. The ones that kind of come off more personally that are, I think, more memorable. I had probably just a couple of years ago a similar circumstance of really what happened with my mom. I was on call, and as an on-call neurosurgeon, you are at home, but you have to respond to an emergency within 30 minutes. And I got a call that a police officer had arrived that was in a motorcycle accident, and he had a subdural hematoma on his brain, which is basically a extremely life-threatening brain bleed in which, really minutes could come down to saving their life. He was in his early 30s, and I immediately, ran to the hospital, talked to his wife on the phone. She was in transit, so she wasn't at the hospital yet, because he had just been brought down, and told her what was going on and told her what we were doing. The team met me in the operating room, and we removed his subdural hematoma, and he was, on the verge of death, and I didn't know how he was going to do. And I just remember walking out outside of our hospital. It was like spring. It was early spring, I think. But the weather was really warm. And so I just looked out on the field. They told me to go talk to his wife. And there was like her. And there was probably like, I don't know, I felt like there was like 20 or 30 different police officers from his division. And just kind of brought this wave of emotion back to me, kind of to like what I experienced with my mom. And so I had to go out there and tell, hey, we did this emergency surgery, and I don't know if he's going to live or die. And, telling they had just gotten married. And so just kind of, embracing her and letting her know we'll do the best we can was just really kind of moving to me. And then he did great. He actually walked out of the hospital after many days of being in the ICU. And I got to know them very well. They actually knew people that I knew, so I didn't know that at the time. But I was able to put his skull back on because we had to remove his skull to allow his brain to swell. And, he's now completely normal. And he and his wife just had their first baby. So things could have been so different. So, and I'm friends with him on social media, so I get to see his life and what could have been in just a few minutes time. Really is just really just kind of it's just kind of cool to be a part of someone's life, to be able to do something like that, to make such a huge difference. So that's probably one of my most favorite stories.
Yeah, no, what a happy ending. That's awesome. So, did he get that hematoma from, you said it was an accident, like some sort of trauma?
It was a motorcycle accident. Yeah. So he was actually in a one of those motorcycle rides where I forgot for the police department. So it was like a celebratory ride or whatever, and they were coming down the mountain. So in North Georgia where I live, there's a lot of mountains. So a lot of folks like to go on their motorcycle and ride in the mountains.
Mm-hmm.
So they were actually on the way back, and he just I think went into some slippery gravel on the road and just wrecked his bike. So it was and all of his fellow officers were with him on bikes at the time and saw all this happen and go down. So yeah, so it was kind of crazy.
Yeah, like they're supposed to be having fun and celebrating.
Exactly. And then they're taking care of their, and one of their brothers, really. So.
Yeah, that's so unfortunate. I'm so glad you were there for them.
Yeah. It was cool. And he's such a good person too. And just happy for that outcome. So.
Yeah, I think it's cool that you guys had mutual friends too, so you can like keep up with him and kind of be like, okay, good. Like, got to see everything is going well.
Yep.
That's awesome. So how do you think that experience shaped you as a physician going forward?
I think all of the situations that we become involved in with patients just really helps us see the patient not just as a diagnosis, but as like a whole person. And I think the more and more you do medicine, the more and more it's not just like, okay, this is a subdural hematoma, we're going to take care of it. You see this as like a 32-year-old man who just got married and is on the brink of death. And, we have to intervene and do something to increase his quality of life. And I think the more and more times that you, even if it's not something life-threatening like that you see the whole person, really helps you not only enjoy what you do, which is so important in your job, but really make a difference and make the right decision for that patient. Because I think a lot of physicians just kind of, tackle things as, we gotta take care of these 5 issues and move on and put it behind us. But it may not be the right thing for that patient unless you really understand their whole situation. So I think that's so important that a lot of people just kind of overlook, especially in surgery, because performing surgery on someone can be life-changing, positive or negative. Like if, the wrong surgery is done because of, a certain situation going on in their life, like maybe they can't dedicate their time to recovering 3 months, but you don't take that to consideration and then they don't heal or something like that. So I really try to gather the whole picture before we do anything. So
Yeah. So situations like this like give you that perspective of like, this is a person and this isn't like a hematoma. This is like a guy with a family. And
yeah, exactly.
I wonder if like getting deeper into your career helps you with that too, because more of the knowledge has sunken in. So you're not thinking so much about all the technical stuff and maybe you're able to like appreciate
100%.
that side more.
Yeah, 100%. I think that the more a person, I mean, like, you being a medical student, just trying to absorb like the actual, pathophysiology behind something. Like, why does a subdural hematoma cause someone to go unconscious versus, fast forwarding into your training and experiences and like knowing that like the back of your hand, now you have time to focus on the big picture situation. I really think that knowledge base comes in with being into practice for like 5 to 10 years is where I think most physicians are in their prime and kind of in their groove, because they know everything, they know most things, and they're able to really just kind of rely on their knowledge base but then focus on other areas. So I would say that physicians that are kind of early on in their practice, you really still are learning, but then the more and more you become more experienced, I think you have time to improve your game, so to speak, and become and just kind of slowly tweak on your ability to totally increase your knowledge base of other things. So
Yeah. So something else I love about your practice is like you guys are all girls in there. And like it's like girl power to the max. Do you think that like environment like impacts the way you practice at all as well?
I mean, I think yes and no. So my practice is, like you said, all girls. It's not always that. It's not all girls. I mean, I still have some guys that play a role into my practice too. But for the main part, like all my practitioners and stuff, and my medical assistants are all women. So I think it's fun. Love the I love all the girl power, and we're all just kind of a group of friends too. So we function really well together. Like I feel totally comfortable, being myself in front of them, and also, knowing that they're going to come to me if there's an issue. So I think that type of just support and collaboration in a group in a medical practice is so important, because someone that's maybe afraid of like admitting they made a mistake, or trying to cover up something because you're worried you're going to get scolded, can really be bad for everybody, not just for the patient, but for everything really. So having that openness and having that comfort level with saying, hey, maybe you didn't make the right diagnosis. It's okay. We'll figure it out, or maybe I forgot to call that patient back, and, we all make mistakes. So we're just all very supportive of each other. And I think it just really helps our practice flow, and it helps us provide excellent patient care. So I love all the girls that work with me.
Oh no, I had so much fun over there. You guys have a good time and you guys are like efficient, and I just future goals one day, just like the girls club at work.
We get stuff done.
Yes, y'all really do. Okay, but I guess going back to this case that you're sharing with us a bit more, do you think that that experience changed the way that you practiced medicine at all?
Yes. I mean, I think everything that we do kind of molds us into who we are. But that particular, you know, case really just kind of flooded the sensory mechanisms in my brain, just because of all that stuff that came in. So that to play, and like, he had some kids as well before. So just kind of, thinking that, well, those kids, that his kids could have been like me when that happened to my mom.
Yeah.
So I just think, treating everybody in the whole situation is so important to um, not only to his care, but to the whole experience, so to speak.
Yeah.
And
And
to me to recognize, like, communications with the family, and transparency, really. I mean, it's not always happy, unicorn dust and rainbows. I mean, I deal with life and death too, and there's every time I'm on call, I have to tell somebody, their family member isn't going to make it. And I think those experiences also mold me into how I can deliver that news better and more compassionate. Those are probably the most challenging experiences that I do, and arguably probably some of the most important, because that there are people that have strokes and brain tumors and trauma, and we can do things medically to salvage their life, but is it the quality of life that they want? And so understanding all those things, like their family situation, their job, what do they love doing, and really asking the family, and would they want this? And you really have to have a very compassionate heart-to-heart talk with the whole family, and understanding all sides of the situations to make the right choice for that patient that may not be able to talk for themselves. So I think all of everything that I do helps me learn how to improve those types of conversations too.
I love that. I love the first thing you said, like all of our experience mold us into who we are. I think that's so true and
It is, yeah,
well said.
yeah.
Have you ever had to like reach out to, I think that a lot of hospitals have like an ethics committee for when those types of decisions are difficult like to be made, or maybe family isn't around to help make those decisions. Have you ever had to reach out to one of those committees?
Absolutely. Yeah, not often, thank God, but there are tricky situations that come in healthcare. Like maybe someone doesn't have um, a family member. I mean, maybe they're estranged from their family, which unfortunately I've seen many times, and they can't make decisions for themselves. We have to appoint someone to make decisions for them. Or I've run into a couple situations where the family lives in another country, and they can't get back to um, be with their loved one. It's kind of wild. Some of the things we run into medicine, and we ultimately just want to do what's best for the patient, and sometimes these things makes it hard to do that. But
Yeah, just got to do your best, I guess.
yep,
So this situation, like the story that you're sharing with us, is really similar to your origin story and what brought you into medicine. So I'm sure it was difficult at times to kind of like process, but how do you think you did process it, and how do you think you coped with it since it was so personal?
um, I mean, it definitely helped me um, overcome. Like, I mean, I think anytime we have emotional trauma as a child, it really just sticks with us for a while, forever, really. And healing from, I always think, okay, well, if I were my mom's physician, do I feel like the outcome would have been different? Or if, something, is there anything that we could have done better to improve that? And it's a soft spot for me. And I think, understanding what we know really helps us kind of, okay, so this couldn't have been changed. Nothing, no outcome could have been different. This is the way it was supposed to be, so to speak. Sometimes those things are hard to swallow. So I think, running into situations like this kind of helps me heal open wounds that I have, and thoughts that I have. So um, it is it's all part of the growth experience.
Yeah. No, because I guess you were able to take control in this situation and improve that story for them.
Yeah.
What type of skills and resiliency do you think you developed, not just with this case, but as in your career as a whole?
I think on that same level of thought, I think, all the skills that we develop, whether that be surgical skills, whether that be note-taking skills, patient care experience, all of those skills allow us to improve over time and mold us into a better physician, a better caretaker for our patients. And I think, resiliency in terms of a multitude of things really helps us become a better physician. And the reality is we're not perfect as human beings, and mistakes are made in medicine and surgery. And I think, that's where a lot of people really have a hard time. That's where burnout comes into play. That's where depression comes into play, I think, in people and in providers. And I think, we all have to kind of give ourselves a break and realize that we're not all perfect. I mean, no baseball player bats 1,000. We all kind of have experiences and maybe misdiagnoses or medical errors that we have to overcome and learn from. And I had an experience in the operating room just the other day with a scrub tech that had done something, loaded a medication incorrectly. It didn't affect the outcome at all, but I could tell that she was just like really devastated. She made a mistake. She's she's been in the surgical tech field for like over 10, 15 years maybe. And so she was just kind of beating herself up. And I'm like, look, that we all make mistakes. And so the mistakes that are good are the ones that don't affect the outcomes, and you can learn from them. Those are the best kind of mistakes because there's no negativity that comes out of it, but we get to learn from them. But there are mistakes that we make that aren't like that. We make mistakes that hurt people. And I think that understanding and forgiving yourself, and then talking to the patient, talking to the family, that is so hard. And, maybe admitting that you made a mistake, or how you could have done it better. That's where a lot of people don't do. And I think if you internalize that and don't talk about it, it can really just be a downward spiral. So for me, I think, fortunately it doesn't happen a lot, but you have to own it when it happens and fix it, or if you can fix it. But mostly just becoming resilient and forgiving of yourself to know that you're going to learn from that and move on. And in medicine, that can be so hard, especially, for people that are surgeons, because sometimes our mistakes can be life-changing for the person that it happened to.
So well said. I think that advice is like obviously very applicable to medicine, but just to anything. Like if you make a mistake, the best type of mistake to make is one that doesn't change the outcome, but you can still learn from it and just own it and fix it if you can. Like, I love that. I'm keeping that in my pocket for later because I think that's really good advice.
With, exams, hey.
Yeah, that's what I was thinking of.
Yeah, like, dude, just because I made a C on an exam doesn't mean I'm not going to become the end goal here. That's just something I want to learn from, of how I can improve myself. And like you said, it's applicable in all parts of life and how you can become a better person because of it. So yeah, I think the biggest part is self-love and self-forgiveness, because the hardest critic is yourself. So you have to learn to love yourself and forgive yourself so you can improve.
I love that. Thank you for saying this. It's literally so true, and I needed to hear it, so thank you.
You're welcome.
I appreciate it.
Don't be so hard on yourself.
Thank you. I'm gonna like record that and like play it to myself. It's gonna be my alarm.
Good. It's so true.
It really is. It really is. We are our hardest critics. I don't know why. It's probably for a reason, but you're right. Be easier on yourself.
We want to be perfect. Yeah. And we're not.
Nope, definitely not. So Dr. Grunch, thank you for sharing this experience with us. I do have one question, if you don't mind. So how's your mom doing today? How did that pan out for us?
Yeah, so that was almost 30 years ago. And she is a C4 quadriplegic. So basically that means she has some function of her shoulders and her right bicep, but beyond moving her hands or legs or body, she's been wheelchair bound. She can breathe on her own, but she is still catastrophically injured. She has 24/7 care. Most of that is provided by nursing staff that comes in and helps her get ready every day. But my stepdad, who is also an incredible human being, has been by her side the whole way too, and cares for her 24/7 as well. And so they live a mile from me, so I'm close to them and available. Of course, I'm like crazy busy with my work and with my kids, but I can easily be over there in a second as well. So just being close to family is important. But neurologically, she hasn't recovered from her spinal cord injury, but her brain still functions perfect. She loves the internet. She can actually control her mouse and her computer with like a little thing that's on her glasses, and she has audio speech, so she is like all over the computer all the time. And you may see her comment from time to time on my social media stuff because she is really proud of me.
I can't imagine.
That's awesome.
But
yeah, it's good. I love being on social media too, because it allows her to feel like she gets to experience some of those things with me that she can't see all the time, like at work. So she really enjoys that.
Yeah, like it's almost like a hey mom, like
Yeah.
like this is what I'm doing today.
Yes.
That's awesome. I'm so glad that she's still with us and that you guys get to like make the best of this moment and keep experiencing life together.
Yes.
That's awesome. Okay, so that story was very moving, and I appreciate your willingness and honesty to share that with us. All the difficulties that healthcare professionals have to overcome is a lot, and we don't get to hear about it unless we have opportunities like this to share them. So I appreciate it. But before we do wrap up, I wanted to ask a couple questions that might be of benefit to future medical students or people who are currently in medical school and might be applying to residency. What's one piece of advice that you would give to a prospective medical student watching or listening right now?
I think my biggest piece of advice is something that we kind of touched on, but I think it's self-care and being forgiving of yourself, because any medical student, we don't get to where we are without doing the work and putting in the work. And I think a lot of the times we focus on what we've done wrong or ways we can improve instead of looking back and saying, wow, I did that, and own it. And, it takes a very smart individual to get to medical school, and the perseverance and the hard work, or else everybody would do it. So I think just, taking a few seconds every day to be, it's not being, it's not like you're blowing yourself up, but you also have to realize that you've put in the work and the time, and you deserve to be there. I think we have a lot of imposter syndrome that goes in the medical field. It's not just being a woman, and men have it too, and just thinking that we don't deserve something, or we don't deserve to be somewhere because we're not smart enough, we're not good enough, or we don't work hard enough. And I think it's just so important to stop those kind of thoughts as much as you can. I mean, I still have them too, but to try to eliminate those and recognize when you think like that, and to try to turn your brain around to not think like that. And it's not being a narcissist, it's being, it's called, self-care. And I think that will help, your just overall attitude and perspective on life to stay positive in such a hard part of our life. And so you can succeed. So
I love that advice. Self-care is so important. And I think at least in med school, we forget to do it. So yeah, I think for prospective med students, take time for yourself. And I'm going to try that positive self-talk as well. Mm-hmm. That's awesome. Okay, so my next question is half for me, half for any other medical student who will be applying to residency one day. What are some ways to stand out for residency?
I think, a lot of people have the same story and the same background, but I think, owning any experience you've had in your life that helps you get to where you are. I think having, obviously a cohesive application helps. I mean, I think a lot of people just want to like add things to their resume and pad everything up, and having research and like renal failure and like neurological issues and cardiac, like it doesn't help build a well-rounded application. So even, I don't know, I mean, like even if you don't want to do cardiology, for example, but having a cohesive application to get to whether it be medical school or residency, just really helps mold the interviewer to know who you are, and just kind of, being yourself, whether that be somebody that's doing a medical podcast or somebody that's a professional, used to be an ex-professional baseball player, focusing on that area of specialty that you really enjoy, that you love, and that compassion will come out because people that are compassionate about something are going to be compassionate about their career. So I think it's important to show that.
No, I think that's great, especially because now that step is pass fail, a lot of people are just focused on adding as many things to the CV as possible, whether it's something they care about or not, just because you got to stand out somehow. So I like that idea of like doing what you love and stacking your application with that.
I think being compassionate about whatever you're compassionate about is going to show, because it's easy to express your enthusiasm when it's real and when it's true, and that will stand through. So,
great advice. Do you work with residencies at all? Like, are you mostly in the?
So I'm in private practice. Okay. However, at our hospital, we do have a GME program in residence. So we have a surgical residency program. So I don't have residents that work directly with me, like in the OR. But when I'm on call, I do interact with all the residents a good amount. And so it's fun getting to reflect on those experiences that I had when I was a resident. And getting to do that. But the short answer is we don't have like a neurosurgery residency or anything like that, but I do interact with residents at our hospital.
That's cool. What was the worst for you? Sorry, last question. I'm just curious now. Was it like pre-med, med school, residency, attending? Like what's been like the suckiest?
God, I mean, they're all not great. I mean, I take that back. I mean, they all have their hard parts, I guess.
Yeah.
So pre-med, I think it's just like the uncertainty and like, the just not knowing of where you're going to be, and that having a goal and just wanting to do something so bad and it not being in your hands is hard. Once you get into medical school, okay, you're like, all right, I can do this. I'm going to become a doctor. I'm here. Let's go. Then you study all this crap that like you seems irrelevant, and you're not doing what you want to do. You're not like, you want to be clinical, but you don't know the stuff yet. Mm-hmm. So that's frustrating. And then, residency, you're finally there, you're finally practicing, but at least when I was in residency, I mean, you're just run ragged, working all the time and having no free time. And then being an attending, it's like, okay, yay, I'm here. And then it's like, oh shit, like I don't know what I'm doing maybe. Or the whole thing is on me, and like my decision could really impact what I do, and not having somebody say, hey, what do you think about this? And like having someone else take ownership, and then it's on you. So I think there's different challenges along the way.
Okay. No, that's fair. I guess we just have to find the beauty in each step, but
exactly. But enjoying the ride.
Yes, it's a journey.
It's a long journey.
Yeah. But you seem happy, so it seems worth it. And I look up to you so much. I'm like very excited to be having this conversation with you and to learn from you. Yeah,
that's why one reason why I really enjoy being on social media is because I think, students like you it's so hard to see the end of the tunnel and like what it will be like, because, the people that you're around may not, that are in medical school, or, your attendings may not have that same ability to reflect on what's going on in their life. So I think seeing physicians that are on social media that are kind of at the end of that journey is so helpful, to keep your eye on the end goal. And so that's, one of the biggest motivating things for me is just kind of inspiring the future medical providers and showing them what it's like. So,
No, and you do such a good job with it because I think, I guess for lack of a better words, like a lot of doctors, like attendings can be kind of like nerdy or like difficult to like relate to. And you're so good at showing people like you can make it here and still be like hip and like funny and like a real person and relatable. Like you're so, so I love what you do and how you like express yourself. I think it's just fantastic.
Thank you.
Of course. But Dr. Grunch, before I do wrap it up, is there anything else that you'd like to share with the students or others watching or listening right now?
No, I mean, I think we touched on everything. I think, just keeping your eye on the prize and staying true to yourself is the biggest piece of advice that I can give. So.
Okay, thank you. Okay, thank you so much for your time, Dr. Grunch. Seriously, such a pleasure.
Thank you for having me.
Thank you so much for watching the Dr. Debrief podcast. I hope you enjoyed the stories, lessons, and perspectives shared today. To make sure you don't miss an episode, make sure you subscribe to the NDMD YouTube channel or whatever streaming service you choose to listen on. And please don't forget to comment and like while you're at it. See you next time.